Congratulations on making it to third trimester. So you it might feel like it's really close for the baby to arrive, or it might feel like it's still a really long time from now because while the pregnancy is generally about 9 months long, sometimes that last month can feel really long. And so, depending on where you are in third trimester, let's talk a little bit about three ways that you can help optimize this time in your prenatal journey. So, first, let's talk about posture because obviously, baby is growing, getting bigger, and it's perhaps getting a little bit more uncomfortable for you to move in the ways that you used to move or do the things that you used to do. But let's talk about posture for a moment and something to pay attention to because movement, doing prenatal yoga, walking, all of these things will not only help strengthen the muscles needed for labor, but of course, it also helps promote blood circulation and that can help reduce swelling and discomfort during the pregnancy. But let's talk about what it looks like when you're sitting. So we want to try to make sure that your hips are staying higher than your knee height if possible. Maybe it feels comfortable to have your hips at a 90-degree angle where your hips and your knees are in line with each other. But I would really start looking at sitting on an exercise ball rather than sitting on a chair. So if you don't already have an exercise ball, you can find the link below to an exercise ball that you could look at. The other thing that you might want to consider is that if you are sitting in a chair, to use a balance disc on top of the chair. Again, there's a link below for that because that can help you get the feeling of an exercise ball while still having the stability of a chair, right? And so using these ways of sitting and try to keep your hips higher than your knees. So if you're doing prenatal yoga, see if you can put a blanket or a bolster underneath your hips to maintain that position so that we keep our hip flexors in a more open position as opposed to getting more contracted when we go into that rounded low back. And in terms of speaking of posture, it's also important to look at our posture when we're sleeping, right? So you might have been using a pillow in between your knees or using something like a body pillow to help it feel more comfortable while you're sleeping on your sides. And when we're doing that, this would be a great practice to continue even after the baby arrives, is to try to sleep, if you continue sleeping on your side, would be to continue using a pillow to help support your pelvis alignment in general, right? So it could either be a body pillow, it could be your pregnancy pillow if you want to continue using that, or it could even just be a pillow that you put in between your knees. And it doesn't have to be a specific pillow necessarily, but I like to recommend that it should try to be your knees should be hip distance apart as much as possible so that it can help keep your pelvis in a more neutral position. And then when it comes to sleeping, we'll also talk about the magic of stretching and deep breathing because as you progress in the pregnancy, it can become more and more challenging to switch sides at night. And while there are definitely benefits to trying to sleep on your left side, I'm really a strong proponent of whatever allows you to get the most rest. So if it feels comfortable to switch sides in the middle of the night, I would help support that as long as it's giving you rest. But in addition to the stretching and breathing that you're doing during the day, when you're trying to turn in bed, something to help pay attention to is before you try to turn, is to take a deep breath in and then to exhale as you're moving. You may need to pause in the middle, take another deep breath in, and then exhale as you turn to the other side. So this helps engage your core, it protects your low back, and it makes it much, much easier for you to navigate that movement as opposed to trying to just push through it or get through the movement in whatever way feels appropriate. So try that next time you're trying to turn in bed. Again, even if you're not pregnant or if you have a family member or a friend watching this who may be not pregnant, trying to inhale before we do a movement and exhale while we're doing the movement helps protect our bodies to stabilize our core in a much better way. If you find that to be helpful, please check out our course, Move Well, Eat Well, Live Well. That link is also below. Thanks for watching this video, and I'll see you next week.